the only show focused on stars' improvement strategies and the leaders who implement them. This is The Rising Stars with Rex Wallace Show, brought to you by Hyperlift.
And welcome back to Rising Stars. This is the show where we being our esteemed co-host Mick Toomey. Good morning, Mick. And I bring on the brightest minds and stars, and we don't pepper them with rapid fire questions. We don't have a boring panel discussion. We have an engaging Sunday morning talk show conversation around the most important topics in stars. However, we're halfway through season 2, and we've done our listeners a big disservice because we say we have the brightest minds in stars on this show. We are only today having one of the absolute brightest minds in stars, and we are so excited to have her on. So, she is not only one of the brightest minds in stars, but she is the face of stars at virtually every conference, the chair of virtually every Rise conference, and just a really beloved consultant and person in our industry. Mick and I are two of her biggest fans, and we just couldn't be more excited to have her on today. She's the principal of Cat 5 Strategies, Stars Consultant Supreme, Anna Handshuh. Anna, thanks so much for being on today. We're super excited to have you.
What kind words? Thank you so much, Rex. And right back at you.
I'm looking forward to this one because it's going to be just like all of our normal conversations that we end up getting into at conferences. So I think this is going to be fun.
Nerds.
The only thing we're missing is a few cocktails, right? for the conversation.
Who says we're missing the cocktails?
That's right, off camera.
And on that note, I mean, listeners, these shows typically are about a half hour long. We try not to make them too long, right? We hope that you see these as an opportunity to pour a cup of coffee, pour a glass of wine, pop some popcorn, and just kind of consider us your Netflix fix for the next 30 minutes. So we'll try to make it engaging for sure, and hopefully a little entertaining. And I think we'll accomplish that today. So now I kind of want to tell Stefan, our producer, to cue the doom and gloom music, and I'll say something like, in the midst of turmoil and trials and tribulations, our heroes are facing imminent danger because, there's so much going on. I think we can all say, I think we've all said for the last couple of months, especially, we're just in this midst of incredible change, right? It's in the star ratings program for Medicare Advantage plans, Medicare Advantage period, across kind of all facets, but stars is such a huge piece of that, and clearly our topic today. So we're in the middle of we have the proposed rule that came out a couple months ago now. We have the advance notice that's still sitting in our laps. We're still in the comment period on that one. And the biggest changes we've probably ever seen, which or at least they're being proposed, right? We won't know until April-ish, what the final notice the final rule and the final rate announcement will hold, but we think we do. Lots of changes in there, but one change is really bigger than all of them combined, I think, from a stars perspective, right? And that one change is one we want to dig into today. It is a proposed change in the hold harmless provision of the improvement measure. And I've actually, seen some articles and some things published on this over the last couple of months. And I've seen some things misrepresented. So I don't think everyone, even some of the people that we think should really understand this, don't fully understand this. And so we want to have this conversation today and really dig into this. So Anna, first question to you, to kind of start the conversation. Can you help our listeners understand what is this change? What is the hold harmless provision of the improvement measure, and why is it so potentially impactful?
Thanks, Rex. So let's first read CMS's own words on what did they say they're going to do. So I'll go ahead and read that. And they wrote in the proposed rule, We believe that the hold harmless provision for the highest rating is not needed for 4 and 4.5 star contracts because they still have the potential to increase scores across measures and thus their star ratings. In order to encourage continued improvement across all measures for contracts with 4 and 4.5 stars for their highest rating, we propose to modify the language, and then they tell us where they're going to modify it, to apply the improvement measure hold harmless provision to only contracts with 5 stars for their highest rating beginning with the 2026 star ratings. And we welcome feedback on this proposal. And I'm sure they've already gotten lots and lots of feedback on this proposal, including AHIP's really cogent feedback on the proposal that they've provided to CMS, letting them know, their concern about this already. So let's talk a little bit about hold harmless to begin with, right? So the hold harmless applies to how CMS applies the score that the health plan receives on the improvement measure. And as we know, the score can be over 3, right? 4 and 5, or it can be under 3, 1, 2, or 3. For plans where the improvement measure would help them, they use the improvement measure and they calculate star ratings with the improvement measure. In the cases where the improvement measure sometimes would have the potential to harm the plan because it has a weight of 5. And so let's say you get a 2 on the improvement measure because you didn't really improve year over year. If you get a 2 on the improvement measure, you're getting 5 2s basically. And so it has the potential to bring you down. So CMS has said in the past, if you're a 4 or a 4.5 or a 5-star plan, we are not going to let that hurt you. We're not going to we'll calculate it both ways, and if it hurts you, we won't use the calculation with the improvement measure. What CMS is proposing is to take that away, that hold harmless, from 4 and 4.5 star plans to really only hold harmless the 5-star plans. And like they said, they're hoping that this would encourage continued improvement across all measures for those 4 and 4.5 star plans. So a really big deal with lots of potential impact. As a matter of fact, I think it's the one with the most potential impact. And I think you guys have calculated some of that already, right?
Yeah, I mean, no question. You look at this, I remember Rex was the first one that showed these numbers to me. But, I think what CMS said that they're going to save $25 billion over the next 10 years, is that what it was? And then 19 or 20 of it relates to...
Exactly.
And you're right, Anna, we did run some numbers. We wanted to see, how big is this impact really going to be? How pervasive? And it's profound. I mean, you think about, we're all, done a fair amount of consulting in this space. And, how many times have we seen a plan get into 4 stars and, not perform well on QI? And that's the fact that the hold harmless was there saved them. We ran the numbers, and 36% of plans, their contracts in STARS 2023 that got 4 stars wouldn't have gotten it if this had been in place. And so, that's how you make up that 19 billion, right? And we then applied some revenue numbers to it. So those contracts that lost $1.8 billion just for STARS 2023. And, for some of these contracts, they lost over $200 million. I mean, you think about the kind of impact that has in your organization just from this one change. It's significant.
It's huge. Yeah. Yeah, exactly. So over the next several years, all of the STARS changes that are being proposed combined, like you said, Mick, $25-ish billion in savings for the federal government. That means MA plans don't get those quality bonus payments anymore, or $25 billion less in quality bonus payments. And almost 20 of that, yeah, is all this one change. Yeah, the numbers I've seen from some other actuarial and consulting firms too is that, yeah, mirror what you just said, Mick. So a third to a half of 4-star plans will drop below 4, but then also a third to a half of 4.5-star plans will drop to 4. And I think, I think another important piece in here is when we think about all the different changes that are happening and how they might collide with each other. So if I'm a 5-star plan, I'm probably pretty good at member experience. It's not guaranteed, but I'm probably pretty good at member experience because 60% of stars is member experience right now. So to be 5 stars, I'm probably pretty good at that, right? But all of a sudden, they're proposing those member experience weights drop back to 30% of stars. So that's probably going to hurt me. And then we have the health equity index reward potentially replacing, the reward factor, which is going to probably take most of my reward factor away. I'm guessing if I'm a high performing plan, I probably don't have a ton of members that have social risk factors. That's not definite, but that's a pretty typical case, I think. So now I was a 5-star plan, but I find myself probably losing a half star from the reward factor, losing some from the member experience weight drop. I'm down in the 4-star range. Now I'm susceptible to this hold harmless, the hold harmless provision is not applying to me anymore, potentially. So could we see 5-star plans dropping to 3.5 because of all this? What do you guys think?
Well, so let's take all of those. Let's dive deep into those one at a time, right? So one of the things that you talked about was the reduction in weight of the experience measures. So there was a huge hooray when CMS said, oh, we're going to take these from 4 to 2. But when you really start thinking about it, for the higher quality plans that typically did well in CAHPS, but also did spectacularly well in things like the disenrollment measure, the telephonic measures, the appeals measures, because they just operationally do well in those measures. Those were gimme measures for them, right? So they were doing very, very well in those measures typically. And not only were they doing well, but at a weight of 4. And so when that goes away, if you look at the savings associated with that proposal, you see that there's significant savings there as well. It's not a cost to the program. There's savings, which means that CMS has done the math and they've realized that bringing that back down to 2 is going to reduce payment to some plans, right? And it's by a significant amount. Otherwise, we'd kind of have a null effect in terms of savings. So that's one. So we know that is definitely going to hurt some plans, and I think heavily weighted on the ones that have traditionally done well in those measures. Plans need to think about, hey, which patient experience measures did I do well on, and consider whether those measures were helping them. The second thing that you were talking about was the elimination of the reward factor. So just taking that reward factor out already drops almost all the 5-star plans, and about half of the 4.5-star plans down half a star, right? So already those are now in play, so to speak. They're in play for that reward factor, or for that whole harmless issue that we've been talking about. I don't know about going from 5 to 3.5, although we did see that happen. Even in this last 2023 round, we saw that happen. So, I think this exacerbates the situation. What do you think, Mick? You've probably run the numbers and know exactly.
I mean, we've run so many different numbers, so many different ways. But I think if you think just broadly, right? I mean, these changes, in coming on the heels of, we had Tukey, we had better. We've seen a number of things that had a pretty significant impact. But these changes, I would say, just the QI piece and the reward factor piece, have the not only potential, the very likelihood to really upend a number of contracts like the way their whole stars world works and what they've been used to, really since the beginning. You take away reward factor, 30, 40 basis points goes away, triggers QI. And with the weight change, right now, if you drop a star rating in QI, it costs you about 5 points, right, per star rating per QI measure. But with the weights going down and those 5 weights staying the same relatively, it gets more costly, right? So now you're losing 7 points-ish, right? And in addition to all the other things, so I just think it's going to create a scenario where plans that really haven't had to think about a lot of this stuff, they're going to have to start thinking about it in a very significant way.
Yeah, what you just said, and just to kind of put a finer point on that for the listeners. So right now, with all the weights of every stars measure combined, it's right around 100. That means a 5-weight measure, like the Part C improvement measure, is about 5% of stars because the overall weight's about 100. But like Mick said, when these member experience weights drop from 4 back down to 2, we're going to be down in the, 70 or 75 total weight. So those 5-weight improvement measures, as a percentage of 75, a lot more important than as a percentage of 100, right? So they become more and more important, and the other measures become more and more important too. But nothing becomes as important as those 2 improvement measures. I think it's when I was doing some research on this, I dug back into, because I didn't remember when stars first launched. I don't think the improvement measures existed. I think CMS, I was looking back and I think in the 2013 call letters when they introduced the concepts of the improvement measure and brought those into play. And their actual wording was, when they were introducing it and proposing it, they said, our methodology will not penalize high-performing plans and will not reward improvement over attainment. And clearly they're going to now, right? They're going to, like, if you're attaining, and I guess you have to define what attainment means. I mean, I think back then they meant, if you're attaining high performance, which is largely 4 stars, right? So if you are 4 stars or higher, that's when the quality bonus payments come into play. That's when kind of everything really matters. And to this point, that's when the improvement measure, didn't hurt you. Now,
don't forget they used to have the 4-star threshold.
True,
back then,
true.
right? And so, what they meant about attainment was getting there.
You're right. Yeah. So much has changed since then, but clearly, yeah, attainment now means, assuming all this happens, it means 5 stars, right? It means if you haven't attained 5 stars, then we are going to reward improvement over attainment, right? Unless you're 5 stars, and that's what attainment means. So we're seeing a provision that up until now has applied, because about half of contracts are 4 stars or higher, right? So about half of contracts were not hurt by the improvement measures up until now. But now, if it's only 5-star plans, we're talking about in any given year, 5 to 15% of plans are the only ones that won't be hurt by it now. That's a huge change, right? I mean, everyone else is susceptible to dropping.
Yeah, and I think one of the posts that I saw online from another consultant had calculated that almost 3 million members who are currently in 4-star plans are going to drop out of 4-star plans. And so what does that mean for benefits? What does that mean for payments and for formulary design and for, all of those, things that members rely on?
Rex and I had done the pre-conference workshop at the RISE Masterclass, and we had just laid out, it was all about the stars math, and here's kind of how to think about it. And we were talking about, kind of depending on what your situation is, maybe you focus a little bit more on QI, basically if your score is kind of around here. If you're over here, maybe you're looking a little bit more at reward factor and, how do you think about this to optimize things? And then we go to dinner and CMS drops the bomb and it's like, all right, we got to put a new presentation together, because it totally changes the strategy, right? I mean, now, like you were saying, Anna, all these plans that used to not worry that much didn't have to worry about QI. now pretty much everybody does. Like, this has to be part of your strategy now. I mean, it's completely changed our little scorecard processing. Like, what do we want to present? Because now we're doing like QI, essentially kind of waterfalls, glide paths, to start looking at what it is on a monthly basis, because it's all of a sudden important across the board, and you've got to be figuring out, how are you on top of this at the beginning of the year, not waiting to the end and seeing how it all shakes out.
That's a really important point. And one of the things that plans really need to understand is what is their current posture. And so they need to run their numbers and see, is this going to affect me and how? And then they need to play out a variety of different scenarios to help, understand what their current posture is. So one of the things that they really need to get good at is explaining to leadership and those that can take barriers out of the way, that are going to need to approve new ways of doing things, to explain this highly complex methodology to them. And they're going to need to be open to understanding and making changes, because what got them there today is not going to be what keeps them there in the future.
Yeah, if you keep doing the same stuff you've been doing, you most certainly are going to see downward movement.
Right.
No question.
Yeah. So, especially for organizations where change management is very iterative and it takes a long time to accomplish, those are the organizations that I think are at the most risk of being affected, because they're going to be very slow to react. So if you're listening to this and that's you, consider, talking with your leadership about the importance of speeding up your change management process and speeding up your decision-making process.
You've got to think, I think about some of the joint clients that we have with Rex, and, you look at some of the 5-star contracts out there, and they're just dialed in, right? They've got the Measure Champion thing laid out. They are organized and set. And so you have to think that a lot of those will be able to make that shift. We have a little bit of time before this stuff comes in, but I think it's those those plans that actually are getting on it right now and starting to put things in place. Because as you said, Anna, this stuff doesn't change overnight. So it's a big shift. So we've got to start getting that stuff in place essentially now, so that when it does come into play, you're ready for it.
Yeah, and when I think about the defense for this change, because and even most of these changes have they hurt plans, but they benefit some plans, like the member experience weight changes. Some plans are in favor of it, some are not in favor of it because it's going to hurt them. Same way with the health equity index. If I don't have many members with social risk factors, or if I'm not doing a good job of managing them, obviously I'm not a fan of that change. But if I am, I'm going to get rewarded in a way I've never been able to get rewarded before. There are plans that are going to benefit from that. This change, you could argue that, of course, 5-star plans are in favor of it, but I think with the other changes, I don't think 5-star plans are secure. So I don't think anyone is necessarily benefiting from this, unless the ones in the end who do become 5 stars, who are in that 5-star threshold. But I just think there's no guarantee to being 5 stars anymore because of all these changes. But the defense mechanisms, I feel like, number one is to be 5 stars, obviously, which that's a whole set of challenges that, another conversation. But I think number 2 is to make sure the improvement measures are as high as they can possibly be. So to continually improve. And, that's where, Mick, I know when you're talking to plans about the improvement measure and about what is that, how do you improve the improvement measure? I mean, not every measure influences it. Most do, but not every. But then, when you're setting targets, right, it's not setting targets for the next stars threshold. It's setting targets for a specific rate that is going to achieve either significant improvement or move you up from significant decline, right? But Mick, can you kind of talk through that?
Yeah, I mean, I think it's a really good point that you bring up. I mean, you go back, I'm going to stray a little bit, but like when you go back to thinking about the Tukey stuff, people understood it in concept, right? But very different about how it actually applies to me. And then when you have to explain that to leadership, I mean, so we've been through a whole lot of that. And I think this has kind of a similar feel because you talk to a lot of people in the stars game right now. Not everybody really understands the nuance of the QI measures. And, you know, I was frankly going to ask Anna to expand on this too, but, you know, the way I think about it, you need to make sure that you, your team, your leadership really understands how the QI measures work. You know, what does it take to get to kind of end up on that 4 or 5 star rating? How do the no significant change, significant decline, significant improvement, how do those work? How do you project what those thresholds are likely to be? How does that adjust, you know, based on your performance? And then how do you kind of keep tabs on that as the year progresses? So I think the first fundamental piece is truly understanding how it works and how to think about it within your organization. But Anna, what would you add or change from that?
Really good points. So I said earlier, plants really need to do a better job of understanding their posture. There have been very few star teams that, at least that I know about, and I don't know, you guys touch a lot of star teams as well, that don't initially, or, you know, just kind of their comfort zone is that they work the improvement measure as an afterthought. They're not working it front and center and saying, you know, this is of utmost importance. And
Right.
what typically ends up happening is that they're working measure by measure, and once they get to the goal, they take their foot off the gas. Whether it was an improvement or not an improvement, they take their foot off the gas. And so you might have achieved the same star score for a particular measure, and still it counts a significant decline because you didn't improve over last year. So the important thing is that even very small changes, sometimes handfuls of members can make a difference and bring you a significant improvement versus a no change or a significant decline. That's really important to understand, that if you get this extra handful of members and you continue to work them till the very end and not leave any data on the table, that it's going to help you. Even if you're in that 3 or 3.5 and now 4.5 stage, it even becomes even more important not to stop once you achieve your goal. So even those lower rated measures or you know, measures where you're not doing as well, it's important to continue to improve. I think of very simple measures like OMW, that there's no reason, there's so many plans that have a 1 or a 2 in OMW. Why? And they're not working it, right? Because it's a one-weighted measure. People don't see it as important, but it would be great to take some of these measures where we're not doing well and just get directionally correct on them.
Well, and you brought up some good points because, you know, one, you know, Rex kind of mentioned this earlier, but we focus on this a lot when we're working with plans to do target setting at the beginning. Because, you know, let's look at what kind of measure movement is realistic, right? You don't just set your target at a 4 or 5 star because you feel like you should. Is it realistic, right? But maybe it's not realistic to get to that next star rating in this next year. But it is very realistic to get up above the QI significant improvement threshold. So I would say, you know, work to build that into your target setting from the outset so you can maybe sidestep that landmine that you're talking about. But as the year progresses, you know, you use OMW, you know, sometimes there are big gaps between cut points, right? And it's like, wow, there's no way we're going to get up to this one. So you stop. But if you just did a little bit, sometimes it's like when we go through the target setting exercises, we're highlighting what the projected QI significant improvement threshold is, because it's a piece, right, that you should consider. And more times than I can count, someone's like, I'm not sure if that's right. That looks like we only have to move it, this much to get to, well, that's actually true. And so that's part of it, is uncovering some of the details around your contract with your numerator denominator. Like, how does this apply to you? And how do I make decisions as the year goes to really optimize my scores?
Yeah, it's the star ratings thresholds for every measure. They're published, or at least, well, last year's published, and we project the ones that we're working on right now. But I think most plans have gotten, maybe not most, but many plans have gotten good at that, right? Or at least having something to project for, so they know to hit 3 stars on OMW, they've got to hit this rate, or they think they've got to hit this rate, right? But on the improvement measure, there is not a published rate, or right. It's based on you. It's based on how you performed last year, right? And it's not very much typically. Like Mick's saying, it's maybe, sometimes it's less than a point, but sometimes it's
very
3, 4,
often
5
it's
points.
less than a point. Yeah, very often.
But it's
surprisingly
not.
So.
You might have to jump, 10 points to get to the next stars threshold, but only 1 point if you can do the math. If you can, if you can understand the calculation and apply it to your data to understand, I've only got to improve by 1 point to get significant improvement on this measure, which is going to help me in the big scheme get 5 stars on the improvement measure for either part C or part D. So yeah, it's such an important exercise that I think many plans still have not nailed. They don't know how to do. I personally know a lot of plans who don't know how to do it yet. But it's sort of that thing that it's been the highest performers who have probably known how to do that now. Now it's going to be anybody in the 4-star range or higher, especially, right? Like you better understand that, or you're going to be flying so blind, and you're gonna get caught flat-footed, and you're going to fall big time.
Like Anna was saying, it's been an afterthought for some folks. They'll find out what they got when the numbers come out in October.
Right.
And it has the potential to catch a lot of people off guard if they're not on top of this one. I mean, the reality is, it makes sense that you don't see a lot of contracts necessarily focusing on it traditionally. You're above 4 stars, it's not going to hurt you, at least. And as Anna said, kind of an afterthought, kind of a also ran situation. And I think the thing that really culminates is the formulas are not like super simple and straightforward and really clear. Like, if you look at some of these formulas in an Excel thing, they're a foot long. And so it can be daunting, but it's because of the power and the impact, it's definitely worth getting to know those. But
you can do it, right?
It's very doable.
Get to it. Yeah.
It's very doable. Yeah.
Plans have data science teams that do it. Mick, your organization does it, right? That's your bread and butter, and is helping plans understand. So it can be done. You can have an understanding of measure by measure, what are my thresholds to climb up from significant decline to no change to significant improvement, right?
Yeah, we're not rocket scientists. Everybody in your organization can do this. It's just you just got to sit down and do it.
And CMS has some very valuable tools that not a lot of plans know about, right, or request from CMS. And I think you know what I'm going to say right now. So whenever I start working with a plan, one of the first things I do is have them request, or I request on their behalf from CMS, I request their star ratings calculation worksheets. And CMS will send you these spreadsheets where they keep the math for your particular plan on how they calculated your star rating, your latest star rating, and they can actually go back in time and send you prior years as well. So if you've missed this opportunity, it's a really great tool. It allows you to model out different scenarios based on the cut points that CMS has put in, and one of the things that they send you is the improvement measure calculation. And so you're actually able to model out, oh, well, what if I had an extra point here? Would it show significant improvement or significant decline? And so not only are there terrific tools that you can rely on, and consultants, right? So I'm sure, Rex and Mick would love to help you out, but you can also do some self-service with some of the tools that CMS has put out there. The key then, which is, where Mick and Rex come in, is now what, right? Now what do I do with it?
And Anna. But yeah, those tools, I totally agree. Those tools are so helpful, and we do that too. That's one of the first things we do is request those from Joy, and yeah, I mean, it's information you simply must have. Yeah.
Yeah, and those QI spreadsheets you're talking about, Anna, you can run the models right there, but you can also kind of use that the foundations of those formulas to be able to do more forward-looking things in future years. So it's a great tool to be able to resource.
Yeah, I love to reverse engineer that that spreadsheet. Go, what can I do with this, right? What's it telling me, and what can we do? So I love that. I love that they make it available for plans.
Super helpful.
Anything we haven't touched on around this important change yet?
I will say, Rex, that and I'll reiterate, I can't stress this enough. You have to create an explainer for your leadership team so that they understand the changes that are coming. And you have to get good at saying, we don't know, right? Because right now the changes are proposed. Mm-hmm. I think, a good number of them will stick. And the reason for that is for budgetary reasons, because of the potential for savings to the program. And so I do think that a lot of these changes will stick. And also, we have to get good at explaining, because it's insurance, right? It's shoring up our plan for headwinds that are coming. And even if they don't come just yet, they're coming. And even if they don't come exactly in this format as stated, they're coming. Because there's no choice, right? The sustainability of the program depends on it. And so I think, the big thing is create an explainer of all of these potential changes, and then start figuring out, if this were to happen, how would we handle? What is our current posture? What are our risks? Monetize them, understand what that could potentially cost you. Talk with your actuaries about, here is how our ability to offer the services we want, the supplemental benefits we want, the co-payments we want, how will that affect our competitive position in the market? Here's how that would affect our enrollment. All of those things are really important to start having conversations about, because they're long, difficult, and complex conversations.
And it's a lot. You're so right. That's so important. And in December, we had a 90-minute meeting with all of our clients where we just talked through the STARS impact of the proposed rule. Then we had another 90-minute meeting in January where we talked through the non-STARS changes, so the MTM and UM and marketing, right? All of those things. And then in February, did the same thing around the advance notice, right? And it's not like we had time to spare. I mean, 90 full minutes just kind of regurgitating, this is what the changes are, this is what you need to know, this is what you need to do. It's so much, yeah. So, all right. So, great conversation. Anna, so glad you came on today. Real quick, if people want to kind of keep up with you, follow you, if they don't know you, anything you'd recommend as far as how they keep up with you, LinkedIn, webpage, anything like that?
They can keep up with me on LinkedIn. I post regularly, or they can reach out to me at Handshuh at cat5strategies.com.
Awesome. Thanks so much. Really great conversation, and so glad we finally had you on, and we'll have to do this again. So thanks so much, and thanks, listeners. We will talk next time.
It's my pleasure.
Thanks, Anna.